Track 5. Why change is needed. This track is approximately 13 minutes long. Why change is needed. 24. It has been more than 10 years since the creation of PIP. The number of adults of working age claiming extra cost benefits for disabilities and health conditions has been growing since before the pandemic and continues to grow at a rapid rate. We need to consider whether PIP remains fit for purpose, supports the best outcomes for disabled people and provides value for money for the taxpayer, and whether the cash benefit is targeted appropriately to those with the greatest needs and costs. 25. Since 2015, the proportion of the caseload receiving the highest rate of PIP has increased from 25% to 36%. Note 6. Stat-Explore. 25% of the caseload in 2015 received enhanced daily living and enhanced mobility compared to 36% in January 2024. Refer to stat-explore-home. https://stat-explore.dwp.gov.uk/web-api/jsf/data catalog explorer.xhtml. PIP cases with entitlement table. Additionally, 7% of working-age people in England and Wales are claiming PIP or DLA. In 2022/3, the government spent £15.7 billion on extra-cost disability benefits for people of working age in England and Wales, and the OBR have forecast that the cost will rise to £29.8 billion in nominal terms by 2028/9. Note 7. Benefit Expenditure and Caseload Tables 2023 gov.uk https://www.gov.uk/government/benefit-expenditure-and-caseload-tables-2023. Benefit Expenditure and Caseload Tables 2023 gov.uk https://www.gov.uk/government/benefit-expenditure-and-caseload-tables-2023. This is significantly higher than the OBR forecasts in the early 2010s, and forecast expenditure for PIP has regularly been revised upwards at fiscal events. 26. Additionally, many more people being awarded PIP now have mental health conditions than when it was first introduced. Out of the roughly 8 million adults of working age in England and Wales who say they have a disability or a health condition which causes substantial difficulty with day-to-day activities, 3.7 million say they have difficulties with mental health. 27. We know that across the claimant caseload, some claimants will have significant extra costs related to their disability, and others will have minimal costs. We want to ensure people get the support they need to achieve the best outcomes. The scope of this Green Paper. 28. The consultation will focus on the main non-means tested benefit paid to adults of working age with disabilities and health conditions. Personal independence payment. Other extra cost benefits are not in scope for this consultation. 29. We are committed to delivering support for people in England and Wales who have care needs which arise after they have reached state pension age, and they will be able to claim attendance allowance as now. 30. We recognise that the benefit system has an important role to play in supporting people nearing the end of their lives. We remain committed to there being support for people who have 12 months or less to live. 31. We also recognise the important role that unpaid carers play in supporting disabled people and people with health conditions. If support for disabilities and long-term health conditions were to be delivered through a new system, as explored in chapters 3 and 4, there would be implications for carers' benefits. We will carefully consider these implications when taking forward this consultation on disability benefits. 32. In March 2023, the government published Transforming Support, the Health and Disability White Paper, which set out our vision to help more disabled people and people with health conditions to start, stay and succeed in work. The White Paper announced the government's intention to remove the existing work capability assessment so that in the future there is only one health and disability functional assessment, the PIP assessment. This will remove the existing Universal Credit (UC) Limited Capability for Work and Work-Related Activity (LCWRA) element and replace it with a new UC Health element. This consultation will consider the implications of PIP reform on the gateway to the UC Health element. Priorities for change. 33. Throughout this Green Paper, we will be guided by 3 priorities, explained below. These are: providing the right support to the people who need it most, targeting our resources most effectively, supporting disabled people and people with long-term health conditions to live independently and reach their full potential, providing appropriate support to those who need it most. 34. We know from our research that benefits like PIP are used by recipients to meet a wide range of costs covering all different aspects of their lives, and that these costs are generally integrated into people's daily expenditure rather than specifically for their health and disability-related needs. Note 8. Uses of health and disability benefits. gov.uk. https://www.gov.uk/uses-of-health-and-disability-benefits. 35. We know that disabilities and health conditions affect individuals in different ways, and that support needs can vary widely from person to person. We need to understand these varied needs and ensure the right support is provided for people claiming these benefits. Targeting our resources most effectively. 36. As the government commits significant sums of money each year to PIP, it is only right that we ensure that this resource is spent in the most effective way possible and leads to the best outcomes. We want to ensure people get the services and support they need to live independent lives and reduce their reliance on the welfare system. For some people with certain health conditions, it may be that treatment and other support are more effective at helping them live an independent life than cash transfers through the welfare system. Supporting disabled people and people with long-term health conditions to reach their full potential and live independently. 37. As set out in our Disability Action Plan, this government is committed to tackling the barriers that prevent people with disabilities and long-term health conditions from living independent and fulfilling lives and making this country the most accessible place in the world for people to live, work and thrive. 38. Disabled people and people with long-term health conditions should be provided with the right amount of support, given the opportunity to make their own choices, have equal access to services, be supported to access healthcare, treatment and education, and be able to participate in society on the same basis as other people. Previous reviews and consultations. 39. When PIP was introduced, the government committed to undertake an independent review of the benefit at 2 years after its introduction, and again a further 2 years later. Additionally, there have been 2 consultations covering PIP. Further information on these can be found in Annex C. 40. The first independent review was published in 2014 and focused on improving the claimant experience, ensuring that evidence is appropriately collected and assessments effective. 41. In response, the government launched a consultation on aids and appliances in 2015. The rationale was that a considerable proportion of PIP awards were based solely on the use of aids and appliances, many of which people might be expected to have already, or which could be obtained free of charge or at a one-off cost, and that a significant number of people qualifying on this basis were likely to have minimal additional costs. The government believed that this was inconsistent with the original policy intent of focusing support on claimants with the greatest needs. 42. Following the consultation, on 11th of March 2016, the government announced its intention to halve the points awarded for aids and appliances for managing toilet needs or incontinence, Activity 5, and dressing and undressing, Activity 6, but did not proceed with implementing the announced changes. 43. The second independent review in December 2017 built on the progress of the first review, concentrated on clarifying the use of evidence, claimant trust and transparency, quality and consistency of PIP and longer-term considerations. We have continued to implement the recommendations of the independent reviews as we strive to shape PIP into a modern and dynamic benefit. Devolution impacts across the UK. 44. The UK government is committed to improving the lives of disabled people and people with long-term health conditions across the Union. We welcome views from people wherever they live, including in Scotland, Wales and Northern Ireland. 45. Responsibility for health and disability benefits lies with both the UK government and the devolved administrations. We will continue to work with the devolved administrations to consider the implications of the proposals in this Green Paper in Scotland, Wales and Northern Ireland. 46. The extra cost benefits, including PIP, have been devolved to the Scottish Government since April 2020. Since then, the Scottish Government has introduced a replacement benefit for PIP, Adult Disability Payment, ADP. The Scottish Government is currently conducting an independent review into ADP. 47. The aim is to complete the transfer of all PIP awards in 2025. Scottish Government is preparing legislation for the introduction of their replacement benefits for attendance allowance, pension age disability payment, which is due to be introduced from autumn 2024, and their replacement for DLA claimants of working age and pension age, Scottish Adult Disability Living Allowance, which is due to be introduced from spring 2025. Summary. 48. Our three priorities will be considered throughout each of the following chapters. In Chapter 1, we will explore the option of introducing an alternative assessment model. In Chapter 2, we will explore options for amending PIP eligibility. In Chapter 3, we will explore different models that could be used to meet the extra costs disabled people and people with health conditions face. In Chapter 4, we will consider whether greater alignment with the support offered by PIP with existing NHS and social care services could ensure better support for disabled people and people with health conditions in their local communities. 49. In each chapter, we want to hear your views on the areas for consultation. This government and this department have bold ambitions for disabled people and people with health conditions. Our priority now is to hear your views on how we might transform these ambitions into reality. This concludes Track 5.